Hello, good morning, everyone. I would welcome all of you with me in this session. First of all, I would like to say thank you for the organizer for this conference by giving me the opportunity to be with you today and share my topic with you. And my topic for today is be an outstanding clinician. So this is Haneen Al-Ghamdi with you. I'm a registered nurse in OR working with the neurosurgery at King Fahad Specialist Hospital in Dammam. So let's move to our content to know what we will talk about today. So what's the definition of outstanding clinician? Why it's a goal for us as a nurses and how to be an outstanding clinician. And I will talk about short inspired story and summary, then take home message. So our objective and our goals from this session is to understand the meaning of outstanding clinician, why it's so important for us to be an outstanding clinician, and what's the goal, and some of the challenges that could be faced during our career, and I will mention short story from my experience for you. Next. So first of all, what do we mean by outstanding clinician? When we say outstanding for person, that means we refers to outstanding when you do more than what is required from you in high quality and more effective. For the clinician, we refers here for the health profession which has a direct involved with the patient. For example, the physician and the nurses. Next. So now let's move to the main talk. When we remember ourselves during college, we think about we had this dream. We shared this dream. I want to be an outstanding, or I want to be the excellent nurse, the role model for my colleagues. I want to be Florence Nightingale for this century. So till today we have it until we face the challenges. So let's go to the next. So why being an outstanding clinician is a goal for me and for you in nursing? Because of the great impact on be outstanding clinician. First of all, on the three parties. First of all, in you as a nurse. Because during your journey to accomplish this goal, you have to gain some of the skills and characteristics, and also you will face the challenges, and inshallah you will overcome after time by your patient. And also after you pass this time, you will build your confidence and you will feel more satisfied, and also you will feel the feeling of enjoy. It's part from your life, it's not only a job. The second party, which is include your institution, which include your colleagues. So when you are working with that person who is hardly worker and very serious for their job and responsible for their patient, of course you will like to work with them. This is what happened for the colleagues around you. They will be encouraged to be like you, to deliver the care in high quality to their patient. And we will mention the patient. This is the third party, the patient, which reflects the community. When you take care for your patient and your colleagues as well as. So, for example, in this situation, you are taking care for all the community. So this is the main goal for being an outstanding clinician. Let's move to the next, please. So now, after I'm talking about being an outstanding clinician, I mentioned that you will gain some of the skills and characteristics, some of the skills and not all of us born with these skills, but still we can learn through the attending some conference or courses. For example, this session for you in this conference, which will help you, inshallah. Okay, can we move to the next? So now I will mention some of the characteristics with the simple scenario that we faced during our day. So this scenario we faced when the nurse, she is already coming for the morning and she finished from taking her handover from the evening shift. She will go to the patient room to check the patient. She will open the door and saying, "Hi, good morning, how are you?" Then she will find the patient who is irritable and flushed and hardly breathing. From this critical situation, she will use critical thinking skills. She will look surround the patient position, and the monitor. She will surround the patient. She found the ID band with the allergic. So the patient is allergic, and she found the plate of fruit salad with the strawberry, which the patient is already allergic from. She will take away and elevate the patient's head, administer the oxygen. And also she will be with the patient until this situation will finish. And after that, she will provide the empathy and compassion to the patient by give him the understanding situation, what's happened for them. So she applied the critical thinking, stable emotion, instead to be freeze in her place. When she found this patient in this situation, she ran. So this is the stable emotion. Caution. When she removed the harm things that can make the harm. For example, the strawberry, the patient is already allergic from. Assertive, by her decision, after she finished from this situation, she will report it down and she will talk about what happened. This is also from the advocacy by the nursing provided to the patient. Compassion, when the patient is already finished from the situation, sitting with the patient and supporting the patient. And also organized when she applying the propertizing by the positioning of the patient and administer oxygen. Teamwork, of course, when she take this situation to out with discussing with the team and also informing the team leader. So this is one of the case scenario how you will apply all of these skills, and also you can gain it through the experience. Can we move to the next? The next scenario, which is I faced during my job in OR after I pushed the patient who was already planned to doing the renal transplant. And on the paper of the patient, it's written, it was right renal transplant recipient. After we do the sign in, that means before the introduce the induction, the anesthesia to the patient, and I have to talk about the verification of the patient with the whole team, and I have to speak up and to make sure about it. When I come to the part of the procedure, when I mention it's in the right, the surgeon, they said no, it's gonna be in the left. So this time I ask everyone to give me their attention again. And also this time I asked the anesthesia if the patient received any sedation or no. He said no. This time I include the patient here in the situation, and I asked the patient, you will do the recipient transplant? He said yes. Then I asked him to show me the side, so he will use the hand. Then he said on the left. Then I asked him if it's happened before to decide to be in the right. Then he tell me the whole story. He changed his decision. So in this scenario, what's happened? I have the teamwork. I have to respect them. So this is all the elements I write there. So I have to respect all of them during my communication skills with all the team. And also I have to be cautious, because what's happened now, if we just doing very fast, we will maybe put the patient on the harm situation, because the patient has another plan why he changed. I have to understand, and I have to assertive to speak up to the patient advocate, and also reliable. After what happened, the doctors, he told me, Haneen, thank you about what happened. This is a good way of communication. So open-minded, I have to understand why the patient, he choose to change, and I have to respect the choice. Also, I have to be empathy and coaching. Empathy, because when we enter the OR room, of course, the patient will be anxiety. So I have to reduce it. Before I start the sign in, I just to talk to the patient in my language. I'm sorry, we will speak in English, and we will just reviewing your scenario, what we will do for you. Next. So I mentioned two scenarios with the different skills, but still we have different skills we have to understand in our profession. Versatility, we have to know that, for example, our job required from us to work 8 hours or 12 hours, and we have to know the capability of us if we can work or not. For example, the one, and also here I can say versatility and flexible. For example, I'm working 12 hours shift, but during this time I am post operative, so I have to speak to my leader. Here I'm talking about the team leader for the teamwork. which I am member of the team now. I have to speak up to my manager to let her understand my situation, to support me and coordinate me. Also, desire to learn, especially during COVID. Now, most of us, we are pulling from our unit to cover other units. So we have to understand the nature of the other unit by learning the scope of practice there, and also what's the requirement from me. And also reliable, I have to assess the need of my colleagues also and my patient, to let them trust me. Self-care, you have to take care for yourself as a nurse and in your life, and don't mix your job in your real life. High physical intensity, because all of us, we know that our job is required from us to bend and twist from time to time, carry the equipment, and sometimes the patient. I have to assist my ability for that, and don't make yourself in risk situation or to have the harm. Just call for help if you cannot capable to do. And you in this way you have to take care for yourself. And also, don't forget your vacation. Take your vacations for yourself and for your profession, also to charge your passion for your profession. Okay, can we move to the next? So now I'm talking about what's the skills and what's the impact. It's all also about the feeling. But I have to mention that also, being an outstanding clinician, there is award which is international and national. And because of the time that I have, I will just mention. Later on you can ask me. Can we go to the award we have? The next slide, please. Yeah. So we have the international award, which is Dizzy Award of Extraordinary Nurses for the nurses. And also we have national, the Arwad Award, and Minister of Health Award for Nursing Excellent. Can we go for the next? So I mentioned some of the challenges, and I will just go through it. COVID-19, as I told you, it was a huge impact on us in our personality and in our career. Stigma, for example, in different countries, they have a stigma for the male being as a nurse. And burnout, as I mentioned, sometimes it can affect you and affect your team and also your family. And also we see the big impact of for nurses in Al-Hajj and also in the natural disaster around the world. Next. So this is my short inspired story. It's happened as I think it was the beginning of 2020. So this time my manager she talked to me that I have to go to work in the pharmacy, which is really different from my job in OR. And also it was required from me to work with the different people and different section from the hospital for the first time that I work with them. But after these challenges and conflict that we had, alhamdulillah, I contribute on idea that can be applied on COVID and after COVID, especially during the lack of, when you see the patient can affected because of their medication not received. Next. So our summary is the importance to be an outstanding clinician. It's for you, for your institution, and for your patient, as I mentioned, for the three parties that I'm talking about. And also there is skills and technique. Still we can learn it during our life, and also from the experience. Sometimes it's only from sharing. So don't forget the support of your friend and speak up for them. The challenges may be a part for your practice, and don't feel freezing when it's happened for you, because it's happened for me and most of us. And these challenges will make us to discover more about ourselves and what we can do more. Next. So take home message. Remember, being an outstanding clinician, it's not the destiny for what you are reaching. So it's a continuous process. And there is no special frame to saying that you are outstanding clinician. Sometimes it's simple thing make you unique because you're smiling. So don't forget the small things that make you are unique in your profession by your attitude. Sometimes we have to go out from our comfort zone to learn more, and this is one of the things in the nursing. We are desired to learn, and we have to be like this. Also, don't forget to recognize the people surrounding you, and inspire the people and respect their need and be ready when they are asking for your help. And don't forget to say goodbye and good morning and smile. It will make your day really different. Next. Thank you for that. I'm ready now for your question. You can go down to the Q and A. Thank you so much.